Welcome to Introduction to Systematic Review. Hi, my name is Madhumala Loganathan. I'm Senior Lecturer at the Faculty of Pharmacy, UITM. My postgraduate training was in clinical medicine, in particular on public health and primary care. Through my experience, I know that forming important evidence-based clinical decisions are important. In this first module, we will aim for three basic things. The first is that you learn the steps that comprise a systematic review. Second, identify a well-defined review question. And third, recognize the importance of using rigorous methods to conduct a systematic review. I will introduce and give an overview on the methods to perform systematic reviews. We will cover how to formulate an answerable research question, define inclusion and exclusion criteria, search for the evidence, extract data, assess the risk of bias in trials, and summarize as well as interpret the findings. Not all review articles are systematic reviews, and the reviews that are not systematic reviews are the traditional narrative reviews, which themselves are classified into several types. Only a subset of traditional reviews will use planned scientific methods to summarize information. Only a subset of systematic reviews will include meta-analysis, which is statistical methods that people can use to quantify and combine the results from several independent studies. Let's take a look at what a traditional narrative review is and how it is different from a systematic review. Reviews are important because we cannot read everything and digest them. There are more than 25,000 medical journals, and if you want to keep up to date, you would have to read about 90 journals in full every day. Therefore, traditional reviews are useful in that sense. A systematic review uses explicit, pre-planned scientific methods to identify all evidence on the topic, selecting them, appraising the quality of these evidence, and summarizing them. Again, systematic review is just a way of how we summarize evidence, and it is a transparent, reproducible way of summarizing evidence. And the methods could be applied to any field. You probably have heard of evidence-based healthcare, evidence-based medicine, public health policy. Apply it to your own field or area of interest. It's not simply oriented to clinical trials or clinical practices, but that said, most methods we are going to learn come from clinical trials. As systematic review presents a survey of preceding literature on the topic, we will then know what has already been done. It explores ways that others have solved similar problems. In this way, we are guided on which methodology and approach to choose for future research. It outlines the relationship of the different findings to each other, and hence gives us an idea on what the different perspectives and debates are. It also establishes the gaps or inadequacies, and we can then build on them and justify our contribution. Essentially, there are 6 components to a systematic review. Firstly, to recognize that there is a need to perform a systematic review where evidence exists for the pros and cons of the topic. Secondly, framing a research question using the patient intervention comparator and outcome framework. Next, you will form the search strategies specific to an online database that you will search within.
As I said in the previous video, this series of tutorials will mainly focus on the literature search process required by a systematic review. However, to put these videos in perspective, it is necessary to talk about the typical process of a systematic review and where searching fits in the big picture. If you decide to write a systematic review and you have the necessary resources for such a project, such as people, money, time, library support, etc., the first thing you should do is to define the question you're trying to answer with your review. What is it you're trying to find out about? What are the key concepts in your question? As I mentioned in my other tutorials, we typically use the PICO model to help us define such a question. Recall that P represents patient, population, or problem. I represents intervention, prognostic factor, or exposure. C represents comparison of intervention. The comparison part is optional. Your question may not always have a specific comparison. O represents outcome you would like to measure or achieve. For example, this question here, in patients with morbid obesity, is laparoscopic bypass more effective than open gastric bypass in helping patients lose weight, improve quality of life, and reduce complications? Here, the P is patients with morbid obesity. I is laparoscopic bypass, and C is open gastric bypass, and O is lose weight, improve quality of life, and reduce complications. Now that you've PICO'd your question, you also need to consider what type of question it is. This is a table showing different types of questions and the most useful study designs for each type. This will help you determine what study designs will best answer your question. The example above is a treatment question, and in most cases, a randomized controlled trial is best for answering such a question. So if this is your review topic, you should pay special attention to randomized controlled trial studies when you search the literature. Your medical librarians or other information professionals trained in performing systematic reviews can assist you with defining your question with PICO and determining question types and the types of studies that best answer your question.
Assess the quality of a study. Bias is a systematic error which results or interferes, and we will want to report that in a systematic review. The fifth step will be to summarize the evidence in a table comprising individual study characteristics and the effect sizes. Where the statistical outcomes are possible to be combined, meta-analysis is then considered. Finally, the results from the summary table of evidence is interpreted in terms of strength and applicability to day-to-day practice. Let's dive into step 2, where a research question is framed. Remember that the systematic review focuses on specific questions. That's where we started. For example, on epidural, we can ask if early or late epidural is suitable for women in labor, or as the example displayed, whether first or second generation antipsychotics are more effective. So the first thing I'm going to tell you is that there are different kinds of questions. We have about healthcare, about epidemiology, about interventions. And they are all different type of questions, as it turns out. And each type of question requires a different type of research. Using the PICO framework, it is important that we identify the relevant components, as this will also help us with our search later. The question focuses on the type of data, analysis, and topic to be discussed. Try to avoid research questions that are too narrow or broad. They can lead to the selection of only a few studies, and the ability to generalize studies to any other population may be limited. Another useful resource for refining your search strategy is the Cochrane Handbook for Systematic Reviews of Interventions. You can get these free online. So let's say you decide to look at the handbook. This is version 5.1. And you can see there are separate sections under it for how to define the question and the eligibility criteria. What type of participants will you have? What type of interventions will you have, and so forth. And we'll go through all these topics in a little more detail in semester 2 modules. But I'm just going to show you here about the resource that you can use. If you want to go back to the Cochrane Handbook to see about framing your question, in chapter 5, there are some criteria and key points that you may want to take into consideration when defining your question that you're asking to frame. So for example, I'm not going to go too much into detail. You start with the key points. With a well-framed question, you need to specify the PICO, and with the Cochrane Handbook, there's a focus on interventions. But a systematic review can also focus on other areas, for example, etiology or environmental, inborn characteristics of people. Establishing inclusion and exclusion criteria come after formulating research questions. Inclusion and exclusion are based on preset criteria for specific systematic review. It should be done before starting the literature search in order to minimize the possibility of bias. Eligibility criteria provide the boundaries of the systematic review. Participants, interventions, and comparison of a research question provide the basis for eligibility criteria. The inclusion criteria should be able to identify the studies of interest, and if the inclusion criteria are too broad or too narrow, it can lead to an ineffective screening process. Once you have framed your review question, defined the search strategy and review protocol, you will want to conduct a search. Online databases such as Embase, Medline, Scopus, Web of Science are often the first choices versus, say, individual journals like the Lancet, BMJ, or JAMA, etc. When conducting a search, you can use Boolean operators, which are simply truncation and wildcards and mesh headings. Boolean operators use the relationship between different search words to help with the search strategy. These are simple words, example and, or, and not, which can help with more focused and productive results. Often I find a mind map also helps with putting the key ideas together regarding the topic. Study selection should be performed in a systematic manner, so reviewers deal with fewer errors and a lower risk of bias. Study selection should involve two independent reviewers who select studies using inclusion and exclusion criteria. Any disagreements during this process should be resolved by discussion or by a third reviewer. The next stage is appraising the data of the articles to be included. Biases can impact any aspect of a review, including selecting studies, collecting and extracting data, and making a conclusion. Biases can vary in magnitude. Some small with negligible effect, but some are substantial to a degree where an apparent finding may be entirely due to bias. There are different types of bias, including but not limited to selection, detection, attrition, reporting, and performance bias. In the example shown, When examining clinical effectiveness review, criteria such as whether allocation into groups was random, the sequence of assigning, whether that was concealed, are eligibility criteria of patients pre-specified, and whether an intention to treat analysis was done or not. You can also put the results of your quality assessment in a form of bar chart. An example of specific quality items related to the clinical features of a review question is the P, referring to complete diagnostic workup for infertility, I, intervention referring to no relevant items, and C, 1 year follow-up duration to detect pregnancy. And here we can see the question of, among infertile couples with subfertility due to male factor, does anti-estrogen treatment increase pregnancy rates? The PICO is defined there. And what we're seeing there is a tabulation of this study quality. And so you're now confident of the quality of the studies or articles to be included. Now comes data extraction. Data screening and data extractions are two of the major steps in conducting a systematic review. The data extraction form should be used to help reduce the number of errors, and more than one person should record the data. Data should be collected on specific points like population types, study authors, agencies, study design, target age groups, research strengths from the literature, setting, study country, types of public health intervention, and health outcomes as addressed by the public health intervention. All this intervention or information can then be put into an electronic database. If not an electronic database, at least a table. The use of an analytic framework will be useful, although it is optional. So an analytic framework is just one of the names of what the thing is. It's also called a logic model, and what it does is it links the evidence and how it all fits together in the populations as it relates to outcomes. I'll show you an example, don't worry, but you also see terms like logic models, conceptual frameworks, influence diagram, theoretical frameworks. Those are all terms that are used to discuss analytic frameworks, so don't be confused if they're different words. They're really all the same thing. So what are the components? Well, an analytic framework, as we've been talking about, specifies the population, the intervention, or exposure to outcomes, and sometimes you'll see timing, settings, and comparators put in. These analytic frameworks use arrows and boxes and squares and circles that tell you how everything is joined together. When doing your table, always think of the PICO approach and the information that you had initially set out for. The discussion of a systematic review is where a summary of the available evidence for different outcomes is written and discussed. The limitations of a systematic review are also discussed in detail. Finally, a conclusion is drawn after evaluating the results and considering limitations. Often, the strength of the evidence, its applicability, economic impacts, and future research directions are discussed. And these are the lists of references that you may find useful. With that, thank you.